How's it going? This is Dr. McCartan here. We're doing some hammertoe surgery. This is Alan. How you doing, Alan?
I'm doing really well.
Good. We're about to start. We don't do any general anesthesia, so this is him. Alan asked a great question this morning before going into surgery. You can see here he's had several foot surgeries before. You can see all the incisions. Sometimes they call those railroad tracks when you have the dots on either end of the long incision. It's from this big long incision, the sutures. And here he had those long incision lines. You can see that little black dot on the tip of his toe. So Alan asked me, why did I get into minimally invasive foot surgery? We talked about hammertoe surgery, so we're going to kind of show you a little bit about what's going on. But here you can see they're all crunched. Move your toes, Alan. They don't move. Basically, the joints are fused, okay? So if we look at his x-rays, you can see over here, the joints are kind of fused. This is a partial fusion. It's called a pseudoarthrosis, meaning a fake joint. And here you can see right here, it's fused. When we do minimally invasive foot surgery, we don't fuse the joints, we make small little fractures. So we'll kind of show you how that works a little bit today. This is Alan over here, we just numbed him up. So there's a couple different things you can see. Once again, he already had surgery before. We numbed him up here. The problem is that this toe's kind of coming up and over and they're all kind of caught and overlapping on his toe. So the first thing we're gonna do is we're gonna lengthen these tendons over here. So on the top of his foot, there's a lot of scar tissue, as you can imagine from all these incisions. So the first step is gonna be to lengthen the tendons that are kind of pulling his toe up and over, okay? So that's our first step, and we're actually going to go right through where he had another scar, so we won't have any new scars here. We're just trying to get that second toe from pulling up and over, so we're going to kind of lengthen the tendons that are pulling that over and the ligaments around there. You can kind of see it's already starting to go. Now here, we need to get these toes over this way. So on the bottom, we're going to sneak underneath here, lengthen that tendon on the bottom of this toe. And we're going to do the same thing on this toe that's kind of curling around. A lot of people have that curly fourth toe, this toe over here next to the baby toe. Very common problem. Kind of just all by feel at this stage. We're not really looking at anything. There's no big incision, so we're kind of using the really tiny blade, which is about the same width as a needle, to kind of feel around. So here we can already see this toe is not curling around anymore. Before it's kind of curling like this. Now it's straighter, okay? And then same with this toe. We're going to kind of work on this, and it's kind of pinching over. And first stage for me is kind of, for this patient at least, is more of a soft tissue, okay? We'll pause there. The soft tissue part is done. The toe is already laying a little bit better. Next thing we do is we make a small incision on the bottom of the toe, just like this. Come through, small little instrument here basically to free up some of the capsule off the bone. Then we use our little rotary saw. Goes in right through that same little hole. Right underneath the toe. No more incisions, no more scars, everything's on the bottom. You go through. Basically what we're going to do is we're going to create a small fracture in the toe and kind of angulate how it heals. So we're changing the angle of the pull of the toe. So it's no longer going to loop over the big toe, but we're not destroying the joint. In this case, this patient's already had several traditional foot surgeries, so his joint, unfortunately, is already fused. But for this next one, it's not going to lose any more motion. And it's going to redirect the toe, and I'll show you in a second. We're almost done. This is how fast it goes. How you doing up there, Alan?
I'm doing wonderful.
Any pain? You want to take a
look? None whatsoever.
Just feel a little maybe shaking?
Yep, little vibration. Doing a great job.
Good. Still in here, almost done. Just loosening up some of that capsule. Okay. Now if we look, we can kind of reposition the toe. And now it's no longer going across the big toe. Sitting down real nice. And we're pretty much done. So you're going to split them up for 1 or 2 weeks, see how the swelling goes, and it's no longer going over here where it was kind of stuck and they were all jumbled. Basically, we were able to kind of reposition that toe and everything looks good. We're done. All right, so Alan's all done, and a lot of people ask, you know, if there's any screws or plates or wires. This is how patients walk out in a small post-op shoe, which he'll get in a second. But basically, this is the bandage we put on all of our patients. If there's a bunion or hammertoe, you can see there's no wires sticking out of the toes. There's nothing on the inside, and that's it. So he'll be able to walk out. He can even drive home. An hour ago, Alan's done. 1 hour later, walking out in a post-op shoe. Have a safe drive. Take care.
Well, thank you.
All right, we'll call you tomorrow.
Okie doke.